The concept of rare diseases, according to the World Health Organization, is the disease that affects up to 65 people in every 100,000 individuals. What are rare diseases? Rare diseases are characterized by a wide diversity of signs and symptoms, and vary not only from disease to disease, but also from person to person affected by the same condition. And in this video, I will show you 6 rare diseases, which you probably have never heard of. Foreign accent syndrome. First reported in 1907 by the French neurologist Pierre Marie, foreign accent syndrome is a speech disorder. It causes the native speaker to begin speaking with a foreign accent. For example, an American who has the disease begins to speak English with a French accent. The support group for people with the syndrome at the University of Texas, in the United States, states that the disease is usually caused by damage to the brain, such as strokes and traumatic brain injuries. In addition, other rare diseases, such as multiple sclerosis and conversion disorder, may also be other causes of the syndrome. Because it is a very rare disease, there is no cure. Therefore, psychological tests and MRI scans are performed on patients with the syndrome in order to find out which part of the brain has been damaged and thus treat it properly. So far, only 60 cases of this syndrome have been reported worldwide. Walking corpse syndrome. Cotard syndrome, or walking corpse syndrome, is a very rare psychological condition that causes a person to believe that he or she is dead. In addition, the patient also believes that his organs are necrotic, and that his friends and family no longer exist. The cause of this disease is related to depression, because people with the syndrome have problems in the amygdala, a brain region that processes emotions. Another part of the brain affected by the disease is the fusiform gyrus. This is responsible for the recognition of faces. Treatment for walking corpse syndrome should be based on antidepressants and electroconvulsive therapy sessions. Werewolf syndrome. Also known as hypertrichosis, it is a disease that covers the face and other parts of a person's body with hair. The disorder is so rare that only 100 cases have been documented worldwide. Therefore, little is known about the disease. The only information that scientists have is that it is a genetic mutation and hereditary. The only effective treatment is laser hair removal. Coprolalia. People with coprolalia are unable to control their speech and utter swear words or socially inappropriate remarks. Scientists do not yet know the cause of the disease, only that it is hereditary. Furthermore, there is no cure for coprolalia, but the patient can have Botox treatment of the vocal cords. It does not prevent the patient from speaking obscenities, but controls the volume of what is vocalized. Pica disorder. The name Pica comes from Latin, meaning magpie, a bird known for eating everything it sees in front of it. And just like the animal, the sufferer ingests inedible substances, ranging from vomit, feces, and blood to stones, wood, and hair. The eating of such strange things can cause serious problems for people with the disorder. Scientists and doctors still do not know what causes this disorder. However, many believe that it is linked to cultural traits, as people in some countries, such as Africa and China, eat dirt because of the lack of iron-rich foods, for example. Other researchers think that the disorder is linked to psychic illnesses, such as schizophrenia. Usually pregnant women and children with growth problems develop pica disorder. The disorder can be treated in various ways, depending on what the person has ingested. Usually, the patient just needs to change their diet, because they are missing some specific type of vitamin in their body. Diogenes Syndrome. People with Diogenes Syndrome accumulate objects and tend toward isolation because they are suspicious, not because they want to be self-sufficient. Thus, the syndrome is a disorder characterized by extreme self-abandonment, social withdrawal, apathy, and compulsive accumulation of junk. The causes of this illness are not yet known, however, many scientists believe that the syndrome is a reaction to stress. In addition, they have noticed that individuals who have suffered damage to the brain, especially the frontal lobe, can acquire Diogenes more easily. This is because this brain area is involved with reasoning, decision-making, and conflict control. Tell me if you know any exotic diseases, and subscribe to our channel to stay up to date with our content.